Welcome to Hiroshi Matsuda's Neuroimaging Complete. Let's log in. Case 2. This is a case study. A man in his late 60s has been experiencing postural tremor of the left hand for 3 years. Subsequently, stiffness of the left upper limb was added. T2 weighted MRI image. Flare image. T1 weighted, T2 weighted, flare, and T2 star images at the level of the basal ganglia. Which areas show abnormalities? This is a dopamine transporter SPECT imaging. Specific binding ratio, SBR. The right striatum is 3.48, more than 3 standard deviations below normal. The left striatum is 5.47, the lower limit of normal, and the asymmetry index is a high value of 44.4. Which of the following is the most likely diagnosis? A. Essential tremor. B. Parkinson's disease. C. Corticobasal degeneration. D. Progressive supranuclear palsy. E. Multiple system atrophy. The answer is E. Multiple system atrophy. Please take a look closely at the flare image at the level of the basal ganglia. There is a hypointensity area posterolaterally on the right putamen. There is also a linear hyperintensity area on its outer side, suggesting degeneration of the right putamen. There is a distinct left-right difference in striatal accumulation, with no accumulation in the right putamen. Over the course of 2 years, striatal accumulation has decreased in the dorsal part of the left putamen and right caudate nucleus. The SBR remains markedly different between the left and right sides, with a decrease of about 8% on the right and 5% on the left over the course of 2 years. The normal aging decline is about 1.5% over 2 years, indicating that the dopamine transporter density is declining rapidly in this case. Let's look at another case of multiple system atrophy, a woman in her early 60s. There is hypointensity in the posterolateral part of the bilateral putamen, which is prominent on the right side. In the right putamen, there is a linear hyperintensity outside the hypointensity area. Atrophy of the right putamen is also present. White matter atrophy in VSRAD is seen in the right putamen and globus pallidus. VSRAD analysis of white matter using T1 weighted MRI images has been reported to be useful in the diagnosis of the Parkinsonian variant of multiple system atrophy. Brain perfusion SPECT shows reduced perfusion in the right striatum indicated by the arrow. Dopamine transporter SPECT shows a more prominent decrease in SBR than in the present case, as well as a marked left-right difference comparable to that in the present case. Let us look at dopamine transporter SPECT in Parkinson's disease as a reference. Parkinson's disease also shows a left-right difference in striatal accumulation, with a dorsal predominant decrease. However, this difference is usually not as pronounced. There has been a report comparing antemortem dopamine transporter SPECT in autopsy-confirmed Parkinson's disease and multiple system atrophy. Compared to Parkinson's disease, there is a marked difference in striatal accumulation between the left and right hemispheres in patients with multiple system atrophy. Multiple system atrophy Parkinsonian type is a rare disorder that causes symptoms similar to those of Parkinson's disease. However, patients with multiple system atrophy Parkinsonian type have more extensive damage to the part of the nervous system that controls important functions such as heart rate, blood pressure, and sweating. Anti-Parkinsonian drugs are ineffective. Take-home message. If dopamine transporter SPECT shows marked left-right differences in striatal accumulation, multiple system atrophy, Parkinsonian type should be considered in the differential diagnosis. Please note the hypointensity and atrophy at the posterolateral part of the putamen and the linear hyperintensity outside of it. Analysis of white matter atrophy with VSRAD analysis is also helpful in diagnosis. Thank you for watching.